My name is Shari, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Thank you for coming back today for this episode of the Heavily Meddled Podcast. We dig deep into the hidden world of metal hypersensitivity, where medical mysteries meet modern medicine's blind spots. And today we are talking about something painfully personal for both me and my guest that I will introduce in just a second. We are talking about Tarlov Cyst Disease and how it intersects with metal allergies, especially nickel. Tarlov cysts are fluid-filled cysts from along the nerve roots in the spine, and they often appear in the sacrum, although they can appear anywhere on the spine. They can cause crushing, disabling pain, and nerve damage. They're often written off as incidental findings on MRIs or written off as anxiety, fibromyalgia, just stress, and a litany of other things that those of us who have been gaslit recognize all too well. My guest and I not only share this diagnosis, but we share the same rare disease, the same surgeon, and the same allergy to nickel. We both had Tarlov cyst surgery with Dr. Rudolph Schrot in Sacramento, California. We both had metal microplates and screws placed to close the sacral bone after that surgery. And we both experienced a lot of symptoms after that surgery in ways that no one except us could explain. We later had that hardware removed and experienced pretty meaningful resolution in those systemic symptoms once that metal was removed. So this episode is about that intersection where connective tissue fragility, neural cysts, and systemic metal hypersensitivity collide. And it's about being told that that can't be it. Your body is pretty much screaming that it is. I'm so grateful to have Keslie Mack with us today. And she has walked this same painful, bizarre, and validating path. So welcome, Keslie.
Hi, thanks for having me. I'm so excited to be here. It's been a long time coming.
I know, right? We have been planning this for a long time, not joking. So why don't you introduce yourself and tell us initially how you describe who you are and what you've been through, the short version.
Yeah, so hi, Keslie Mack, of course. I am a mom and a healer, essentially. I have three teenage daughters and, keep you going. I have two dogs and a cat also, but that and a healer. I'm a hypnotherapist, trauma coach, and just a holistic healer in many ways, spiritual healer. It's been such a lifesaver having all of those skills during this journey because it's just been crazy.
And when you said I'm a healer, I took that almost as an affirmation. And wouldn't we all be so much better if we would use that as an affirmation? Because look what we've overcome and our bodies are made to heal. So what a perfect way to just say, I'm a healer.
Yeah.
I'm a super healer. That's my superpower is healing.
It is. And really, it is. That's been my whole life. I was 12 the first time my back spasmed and I thought I broke my back because all of a sudden here I was 12, I'm trying to climb up on the stage. I can't move. Like, what is happening? And that was my first spasm and first initial into the world of pain.
Wow. Okay, let's move on to talk about the story.
Yeah.
And before we do that, let's set the stage for the listeners who heard the word Tarlov cyst for the first time when they showed up here. I just want to give like a really quick primer, and then I'd love for you to add your experience with your Tarlov cysts. But like we talked about briefly, it's basically a balloon or a sac that's filled with cerebral spinal fluid, or CSF as it is known. This is the fluid that cushions the brain and the spinal cord. These cysts form at the nerve roots, anywhere on the spine, but most commonly in the sacrum. It's that bony area above your tailbone. And while they're small and not pressing on anything, they may not cause any problems. They can be asymptomatic for a really long time, but when they expand and compress the nerves after usually a fall or some kind of trauma or an accident, sometimes after childbirth, they can cause deep pelvic or tailbone pain, sciatic type pain down the legs, numbness, tingling, weakness, bladder issues, also sexual dysfunction, and a whole lot of problems with sitting, standing, and walking. It's pretty much an intolerance that can wreck your quality of life. And a lot of radiology reports talk about it being, like we mentioned, an incidental finding and not symptomatic. But for those of us that like live in these bodies, they're anything but incidental. And on top of that, it's people that you're going to find out today with like connective tissue disorders like Ehlers-Danlos, EDS, or something on the hypermobility spectrum. They seem to be more prone because tissues that should be strong and supportive are more fragile. And it's a structural problem that at its core just leaves you compromised. And then you layer immune issues, inflammation, mast cell. We see very often metal hypersensitivity in with connective tissue diseases, and you get this big, complicated slew that most doctors are not trained to recognize. Keslie, is that kind of your experience?
Pretty much exactly. And my first flare, as they call it, because they can go asymptomatic even when you're experiencing them.
Mm,
My first flare was after my child, my first baby. While I was pregnant is when my symptoms started. And by the time I had my third daughter in 3 years and was breastfeeding the whole time, I was a mess. All the extra relaxant and the different hormones in my system just, and I think that's when the first time maybe they flared or something, because
right.
I was handicapped for 6 or 7 years, pretty much right where I was before the surgery. And then, so when it started to come back after I got COVID, it was familiar pain. And it was
Mm,
like, okay, wait, this is back again. What is going on? And this time I had those lovely little incidental findings. It was about 2.5 years ago now. And it was, I looking on my lit thing and there it said incidental. And I'm thinking, wait a minute, S2 and 3. That's connected to a slew of the issues and body parts that I'm having problems with. And there's something in here telling me it's 4 centimeters long. And there's another one. So how could something that was 4 centimeters by almost 2 centimeters long, and then there was other ones that were like a centimeter-ish, two other ones, not be causing all the problems that were connected? It just didn't make sense to my brain. I was like, I gotta look into this again. So
what were you told by the provider? What were you told
I
it
wasn't told
was?
anything. So I'm a super sleuth with my own medical everything. And I basically get my MRI reports and I'm in there looking at my images. I'm measuring myself.
Okay.
I'm Googling, like I'm a super sleuth. I figured it out before my doctor. So what had happened was my doctor was like, yeah, we need to get you to an orthopedic surgeon. Go. They wouldn't see me without a full spine MRI.
Okay.
Okay, so I went and got it. So she wasn't even looking for anything. It was literally just sent to the orthopedic surgeon.
Was it even in the report that there was a meningeal
It was
cyst, a sacral
incidental.
cyst?
It said incidental Tarlov cysts, the measurements of the three cysts.
Okay.
And that's where my brain was like, incidental. And that sent me, like, it wasn't calculating, right? It was
Yeah.
not computing. My brain was like, no, something's off. I
Not
started
good.
to research. And
Okay.
that was when I learned, oh, no, they definitely can be symptomatic. And so many of my symptoms were pointing to that. Now,
Mm,
I do also have bulging discs in L2-3, L3-4, and L4-5. And I have a 4 millimeter bulge in one that's laying down. So I have
mm,
other stuff
right.
going on. So it's what is what, right? And it's like you have to pick a thing to focus on.
Yeah.
Now, I have this metal allergy, right? So going into all this, I'm aware of, hey, once you start doing surgeries, metal starts going in, especially spinal surgeries. I've had them talk about getting replacements before, and I'm going,
Yeah.
I don't know if that feels like a good idea. And here we are, so, to the Tarlov cyst, and the surgery felt right. I am a big person about feeling and my body and does it feel right and doing muscle testing and things like that. And
Yeah.
everything was pointing to get the surgery.
Okay, let me stop you for a minute. So, who actually gave you the diagnosis of Tarlov Cyst disease?
Me. So my doctor was
Agree?
amazing. I messaged her and I said to her, hey, this is not fitting. This can be, and I sent her a ton of information and she was like, whatever you need, you've got it. I don't
Sure.
know anything about this, but I trust you and your
Yay,
body.
doctor.
Oh, I have been
One of the good
blessed.
guys.
Yes. By my primary care physicians, I have been absolutely blessed. Beyond that, wait till you hear about what the orthopedic surgeon said to me.
Oh no.
So she
Okay.
was awesome. She sent the referral to Dr. Schrot, no big deal. I need to pause.
How did you
I,
find Dr. Schrot?
I found Dr. Schrot through the Facebook group. I started to, as soon as I found out from ChatGPT that Tarlov cysts were a thing, and I started to do more research, and then I found the Facebook groups fairly quickly.
Okay.
And I'm like I said, I'm a super sleuth. So I was investigating and finding out, and it was very clear that there were two main doctors. And I'm live in California. So to have one of them right here was, oh, that's easy. And then
Right.
he just happened to take my insurance. But still, you want to make sure that you're having the best doctor do the surgery.
And
So
he happens to be the most friendly in the Tarlov realm to metal hypersensitivity. We'll come back to that later in the podcast because it's a bigger discussion. Tell me for a minute, what were your most disabling symptoms when that cyst became symptomatic?
it was a combination. It was muscle pain and sciatic pain. So kind of muscle spasms in my low back increased and sciatic pain just out of nowhere. I could not get rid of the sciatic pain. It was just brutal constantly. Like it wasn't if, it was how bad's it going to be right now? And my chiropractor wasn't getting rid of it. Like all the things that in the past, which was a similar issue to when I was,
Laughing. I'm laughing.
you gotta love the tail. And she's like hitting her on the microphone.
Every
You
now and then
fucking
the cat
live.
head will come up or the tail. Sorry. Heavily
No, no,
metal first, y'all.
yes, yes. So where was I?
I don't know. Derailed by the cat.
But my symptoms, sciatic pain was the first thing. And what felt like period cramps was one of my biggest symptoms. My boyfriend's a guitarist and a musician, and we were at a jam. And I was like, yes, dance. It was the greatest thing. I was like, if I can't find a dancer, if I can find a musician who will make music for me. So he makes music for me, and I love it. So we're at a jam, and I'm dancing, and all of a sudden I feel like I'm going to get my period. Normally, dance through it because it helps the muscles and everything kind of relaxes, right? And I love dancing, so it usually helps everything. And I just couldn't, it was just hurting. And then I didn't get my period. And I went, well,
Mm.
that's very weird. And then another time when I was kind of walking around. Now I get back period cramps. So I didn't know I was in labor when I was in labor because my back was hurting. And my husband had to say, your back's hurting every 5 minutes for a minute and a half. I think you're in labor. I was like, oh. So I have a tilted tipped uterus, but
Hmm.
like lays all the way back, which is putting a lot more pressure on all of those nerves. It's all back pain. So that's why I was like, why this feels like period cramps. It was so weird. And it just wasn't going away. And I
Mm.
got to a point where I literally couldn't dance anymore.
Mm.
And at one party, I was like pushing through it and I ended up like collapsing on the floor and had to go into someone's room and lay on the bed in tears. And it was partially like, I can't dance. Sorry, it gets me a little emotional because that's my thing. And
Yeah.
I can't dance. And it's just devastating. So
Right.
I'm starting to be able to, a little bit at a time, get back. I can dance a song or two. And then I'm like, okay, now I have to lay down for an hour, but I can
Sure.
do it. But that was the big something's wrong. Because even
Okay.
when I was pregnant with my kids and having all the pain then, I could still dance. It wouldn't cripple me. It was not fun and I would hurt.
It's so different. For me, I could not walk. Like if I walked more than a quarter mile initially in an entire day, like steps
Yeah.
to the bathroom, counting everything, my legs would neurologically stop working. They would get super, super heavy, like really heavy. And then all of a sudden, I would get cramping, stabbing, shooting pains in my legs. And then they would quit. Like I would lose control of them. I never
Yeah.
lost bowel or bladder control, which does happen with some people, but I literally could not control my legs. And this made sense to nobody because I had MRIs, my spine looked fine, but it was consistent and it was reproducible that
Yeah.
my legs would stop working.
Yeah. I ended up there. Now that I have the metal out, that's starting to fade.
Okay,
because
I can't wait.
it,
So I
yeah,
don't want to jump ahead and ruin the surprise for everybody.
yeah,
So we're going to try to make this cohesive. You get the metal part's the best part, but you got to wait because we got to work
yes,
through the rest.
yes, yes.
Okay, so connective tissue, EDS, hypermobility.
I couldn't even address the EDS until this year because I
Okay,
was like, cyst first.
right.
Everything's crisscrossing. I just need to focus. Let's see what the cyst is doing. What does the surgery fix? What does it make? Where are we at after that? Let's just one thing at a time.
But
So
you have diagnosed EDS, is that
now,
correct?
yeah, I was only just diagnosed a few months ago.
Okay, and I want to make sure I parallel our two stories because it's your podcast, but I think it's also mine because I haven't talked about this officially. I just recorded an episode that may air before this one. Actually, it probably will air before this one, where I actually bring the Tarlov diagnosis in, but I haven't talked about it on the podcast yet. So I think
Oh,
it's really important just as a general education. So a lot of people we talked about have some kind of generalized hypermobility collagen issue, even if it's not formally labeled. So Keslie has a formal EDS diagnosis. Are you hypermobile everywhere?
no. In
Okay.
fact, I only do the scale sometimes. It was funny. The day that I went to the doctor for the diagnosis, my body was like, flip, flip. I was like, awesome.
Yeah, and
Okay.
I'm
I
not
can do
double
everything.
jointed anywhere. I'm not hypermobile anywhere but my spine. If I try to do that, forget it.
You
Like I
have
cannot,
nothing.
but now my elbow will hyperextend a
Right.
little bit,
Right.
but that's it. The first time I knew that I even might have a connective tissue type of disorder was when I went to my pelvic floor therapist and she was like, for somebody who was bedridden for 3 years, your hips and your lower spine is like more than double normal mobility. And I'm like, news to me. And she said, you've got this really soft, super silky skin on your forearms. And I don't
Yeah.
scar. I don't scar at all. I've had a million surgeries to my neck and you can't even see a scar. So
Oh,
it's,
really?
yeah, very
All of my
strange.
scars are white and a dent, which I didn't even know was a thing. I thought atropic scarring was a thick thing. I was like, oh, and then I
Oh, that's
looked,
what I thought it was. Is
oh
it
my
not?
God. I was like, I scar weird? I
What's a trophic scar?
know
Define it for me
it's
because I
the
thought it was like the big
collagen.
keloid scar or
So did
some weird
I.
thing.
No, it's the opposite. It's like a dent. So
Okay.
I don't have any that I can show you.
I have one
Um,
that's probably very easy. I don't know if you can see it. It's probably on camera. Can you see the one here?
Not really. Is it like
Okay.
indented?
It's indented. I had a dog bite me there.
Oh, wow. Yeah.
Okay.
Yeah, so not all of my joints are like I've never dislocated a joint,
Okay.
but I have ribs pop out of place all the time,
And I do too. That's interesting. I didn't even think about that, but it's
right?
usually in the back, and I have that can't breathe pinch in your upper back.
I had three out. I'm like, oh, I have a rib out, and then I was like, oh, okay, I can't breathe.
Okay. What about easy bruising? Do you have easy bruising?
No, I don't know.
Okay.
Sometimes I
And you
would
know
say
what we
sometimes,
see, and I don't know, and this is a whole, I talked about this on my podcast as well, is I see metal allergies, Tarlov cyst, lipedema, which is a connective tissue disorder that's a fat storage disorder for women. And it doesn't have anything to do with size per se. You can be
right,
very thin and have lipedema. It's just the texture of the skin looks like an abnormal amount of cellulite. And we're
right.
finding it's really hard fibrotic tissue that holds metals and toxins. And that's a whole other episode.
No
But if
stuff, no
those people,
cellulite, but the beautiful soft skin. I was
yes.
like, wait, skin's not supposed to stretch?
Mm,
Really? You're not
mm.
supposed to be able to pull the skin off your chest? I was like, yeah. I was like,
Really?
oh,
You're not?
no. I'm like, my kids are like, oh, gross. I was like, really? Oh, so it's certain things, but where my daughter, I think, is showing a lot of symptoms of it also. She popped her knee out doing a dance move in a squat, just literally legs together in a squat to legs open in a squat, popped her knee right out of socket.
Oh,
Kneecap
wow.
popped to
Okay.
the side, emergency
There's
room, had to get it
no
put back in
genetic
place.
predisposition there.
But I've never had a dislocation.
Okay.
So it's weird. So the bruising, maybe parts of the
Yeah.
time, but I also use essential oils. So I can't tell because as soon as I have something, I put frankincense all over it and I know that it works because I've missed spots and
Right.
the bruise will be where I didn't put the oils.
Yeah.
I don't know, but I do end up with bruises all over my body sometimes that I don't know where they came from.
Yeah. I
So
would say that's easy
I would
bruising, girl.
say, yeah, yeah, I guess so
I
then.
would say you do have that.
Yeah.
My cyst, so you had multiples. and yours were quite large. So I just had two. I had one on each side at the S2 nerve root, and they were below 1 centimeter each. My findings also were that they were incidental and couldn't be causing that level of pain. And I've got an amazing spine doc, and he didn't gaslight me for any reason. He just said, no, that's not typically what we see.
Right.
And later he became very supportive. And now he even asked for Dr. Schrot's name and some of the other doctors who treat Tarlov cysts. But
Yeah.
when you look back at that part of your journey, what do you wish your earlier doctors had understood about Tarlov cyst diseases and
Well,
pain?
here's where I got gaslighted was the orthopedic
Okay.
surgeon.
Okay.
Was I went to the orthopedic surgeon and I was laying on the table. At that point, I could not sit up. It would just start spasming. I felt like I was sitting on my rock and my tailbone was super sensitive. Like
Right.
I just couldn't sit up. And this doctor looked at my MRI and he looked at me and he said, "Do you see this right here? There's no reason that you should have any of your symptoms." I said, except for the Tarlov cyst that I have. He said, "Those are in your pelvis. That's for your gynecologist." I said,
Oh,
"You're a bone doctor, but that's cool. I already have a neurologist on it who's doing the surgery." And then he was like, "I don't know what to tell you." And I said, "You could start by telling me that 4 millimeter bulge doesn't affect me while I'm laying down because that's how the MRI was done. And I don't have any symptoms when I'm laying down. But the
yeah.
second I stand up and gravity takes hold and I have a 2 millimeter bulge and a 2 millimeter bulge and a 4 millimeter bulge and a 2 millimeter bulge, what happens to those?" This is where the connective tissue disorder comes in. I can't support my spine. I have double scoliosis. So all of the whole area. So I was losing and I'm now after the surgery, my brain was going the numbness. And it feels like your funny bone, that tingle, electrical pulse that is like pins and needles, extreme pain, and your legs drop. I have urinary symptoms. I have what feels like urgency, where I'm like, I just went to the bathroom, so I probably don't need to go, but I'm gonna go check and see just in case. I have to consciously force my urine out.
You have to
Like
empty
if
your
I just
bladder
sit
on
down and
purpose.
pee, barely anything would come out, but it
Right.
does come out.
Right.
Some bowel stuff. I've got some constipation issues, which I'm still not totally sure if that's that or the mast cell stuff, which we'll talk about flared. I
So
didn't
many
even
of these are so interrelated.
I also had some sexual stuff. I was losing feeling, which is starting, it was random. It would be like mid-session or right when I was getting close to climaxing, and then numbness. The
Uh,
whole everything would just
okay.
die. And I was
Okay.
like, gone.
That's fun.
Huge shift since the metal came out on that one.
Okay.
Massive.
Okay.
So that's great. Let's see. I had a whole list of
Well, I
symptoms.
think we can leave people to go research Tarlov on their own. We've proven that it's a problem, right?
It's
So
a problem.
let's bring ourselves back from the hinterlands and get to the surgery and talk about the metal, which is why we're
Yeah.
here anyway. And tell
So
everybody
first,
what happened when two nickel allergic patients had microplates and screws put in their sacrum and then later had to have them removed. So first, I want to start about talking about Dr. Schrot because he's a pretty big turning point in both of our stories. He's one of the few neurosurgeons in the US. I think there's three that really specialize in Tarlov cysts, and he's
yeah.
one of them recommended by the Tarlov Cyst Disease Society. He acknowledges that Tarlov cysts can be symptomatic and then specializes in the microsurgical repair of the cyst and a technique that involves repairing the cyst wall and sealing the CSF leak and then closing the bone with tiny little microplates and screws. And for a lot of people who don't know, we've seen our microplates and screws. Did you get yours back? Because I got mine back.
I had eight
These,
screws and four plates.
okay. And I had two plates
Uh,
and eight screws.
Good
These
six.
plates
Oh,
are the size of the white line on your pinky fingernail. This is how small they are.
tiny.
And for a lot of people, this surgery is really life-changing. For a lot of ways in us, it was too. But then we ran into this problem that most people never think about. It's a huge source of controversy, and that is the metal itself. But you first heard about Dr. Schrot on the Facebook group,
Yes.
correct? Okay. And then first, before the metal thing, or maybe that was part of it,
Oh, it was definitely part of it.
but before that, had you decided you were going to have surgery before you even brought the metal thing into the
No,
equation? Okay.
no.
No.
I was
Okay.
very concerned with the metal aspect. The
Okay.
fact that there was going to be metal in my bone, I was like instantly when I learned that, it was like, oh gosh, I don't know if it's worth it because I didn't realize you could just get it out.
Keslie and I connected on the Facebook group. So the other
Yeah.
surgeon,
So
and I'm
grateful
not
for
going to
his.
say his name because I don't want to throw him under the bus, and I don't want him to think I'm throwing him under the bus. He was taught a certain way in medical school. He's taught a certain way by the reps. He's a brilliant Tarlov surgeon.
Yeah.
Some of the other surgeons, not all of them, use a small titanium micro clip at the site of the surgery. They have different surgical techniques. The other surgeon uses a permanent, it's meant to be permanent clip. The reps tell them, and this is part of the general metal narrative, that it's pure titanium. And for those of you who may just be tuning into the podcast, there's no such thing as commercially pure titanium. It's Ti6Al4V. It's an alloy. It's 6% aluminum, 4% vanadium. And if there is a balance of titanium, there are trace elements in that metal alloy that the FDA does not require you to disclose. And the medical professionals that research this have shown extreme hypersensitivity in systemic patients as low as 0.013 for the nickel that's a trace element. And it's not the titanium that people are usually reacting to, although we are seeing more and more titanium allergies because it's in everything. But it's the trace nickel that's not required to be disclosed that people don't even know they're getting. So a permanent clip really has to become part of the metal narrative. Walk us through how you decided on a surgeon and what you decided about the surgical plan. You knew you had a nickel allergy. Had you had an LTT test before? Did you know you were systemically allergic? Because not everybody with a nickel allergy is systemically allergic.
I did not know if I was systemic. I've had a skin reaction.
Okay.
So basically, in my life, I've avoided allergy metals that have it. Not overly sensitive, not sensitive to some snaps in my pants, but I've never had to purchase special pants or coat my
Sure.
buttons before they rub on my stomach.
Did you have the
So
earring thing?
definitely earrings. I couldn't wear jewelry,
Okay.
but even I could wear it even for a while when I was younger, and then if I would sweat, it would break out. I just stopped using nickel jewelry and didn't really think too much of it. Then it became a whole other ball game.
How did you
Uh,
find out that you had the systemic version, or did you?
so that was after I had the surgery
Oh,
and I was
really?
never diagnosed with it specifically.
So
It
you
was,
chose Dr. Schrot before you knew you were systemically allergic to metal.
yes, because I knew
Okay.
that I was allergic to metal. And so here's where I also had an issue was when I had braces. I went
Okay.
in for braces and I told my orthodontist, I said, I have a nickel allergy. And he was like, okay, no big deal. I had four anchors that were surgical stainless steel, which
Hmm.
definitely has nickel in it. Okay. That was it. The rest of my brackets were plastic. I had
Okay.
clear plastic brackets. That part was okay. So I had chapped lips for the 2.5 years that I had those in my mouth. He then put a titanium wire in my mouth and my lips blew up like I'd gone to Angelina Jolie's doctor.
Like a permanent retainer?
No, like a titanium wire inside the braces.
Okay, got it.
Just this tiny little wire that was
Okay.
5% nickel.
Harmless wire.
My lips blew up. He's, whoa. So he put in a Teflon coated wire, which I was like, "Oh, what? Isn't that bad for us?" But anyway, that lasted until the first piece of food scratched a little piece off and my lip blew up in that section. So I went
Wow.
back. So I ended up with
Okay.
gold wire.
Okay.
I
So
had gold wire the whole
that's
time.
a huge clue.
And
Okay,
if
so
the gold scraped off, the metal underneath the gold would alert what I would have to go get a new wire. So
okay.
it was a very big clue that there was something. I didn't even know there was a such thing as a systemic nickel allergy.
Most people don't.
Totally off my radar. So
Right.
was it affecting other things during that time? I don't know. I was not aware. But what I was
Probably, but
aware of was constant irritation in my mouth. My lips looked like I had lip injections and they were chapped almost the entire time I had braces. So that was
mm.
all a big
And
clue
resolved immediately after your braces were removed, no doubt.
immediately. And I was like, oh, wow, that was way worse than I thought. Like my lips were just swollen and sore the whole time.
Wow.
So that was several years ago. I think I got the braces off in 22. No, it was before the pandemic. So anyway, they've been off for a long time. So I knew I had an issue. And so I was very cautious. So like I said, when I realized, oh, wait, some people use metal clips, that's where I was like, whoa, that's not a good idea. So that was my first kind of looking into it. And at some point you mentioned, because I had asked a question about it, and you mentioned, hey, Dr. Schrot respects this allergy. And I was like, awesome. Because again, he's 4 hours away. I know
Yes.
someone who lives in Sacramento, so he had a place to stay. My insurance already covered him. There was no issue. My doctor could just write the referral and it was good to go. So it made it easy. I would have mortgaged my house if he was in Texas to do that with him.
And let
It's
me go
not.
back and say how he differs in his surgical approach is he does not use a titanium clip. And by the way,
Yes.
he has removed a few of these permanent titanium clips that were done by other surgeons.
Oh,
It's not super easy, but it can be done in the
yeah.
event that there's a severe allergy and symptom picture.
Yeah.
Anyway, or pain picture, but he differs in that he does not use a clip and he uses metal, small titanium microplates that have no constitutional nickel, by the way, because I contacted the manufacturer and made sure before those were put in. We looked for an alternative, couldn't find an alternative. These are craniofacial plates, so that's why they're so small, but no constitutional nickel. He uses these to close the sacral bone with little bitty screws. But after the sacral bone heals, you have a repeat surgery, unfortunately, deductible and all the things, to go in and remove those. It's a very simple surgery. It just takes it out. The bone's healed. They can hand you back your hardware. It's the same incision where they went in the first time, and it's not the complication of the Tarlov surgery itself, where you actually get in next to the spinal nerve roots. It is a little more involved to remove a clip that's there, but that's how the surgical technique differs between the surgeons, and he does not leave any permanent metal once you have the metal removed. Tell me about your symptom resolution after your surgery, and then let's talk about the symptoms in a minute. We'll talk about the symptoms that came in between when you had the metal and then when you had it removed.
Yeah, I didn't have a ton of symptom relief after the surgery. I was quite a bit worse
Okay.
because I was healing. So my particular Ehlers-Danlos affects my tendons. That's where in my life it's really hit is my
Okay.
tendons. It's like I get flares where it just feels like full body tendonitis. And so it's just I always say my joints, but it's not like an inflamed joint. It's the muscle. It's the things like are right near your joints. And I didn't have much relief at all. Really, after the second surgery, I realized having a surgery on your actual spinal cord messes with your nervous system in a different way. For 3 months after that,
Mm.
my everything was discombobulated. And I could not, as a trauma coach, could not see clients for almost 3 months until I
Oh,
was
well.
strong enough to hold really good boundaries. I'm a hypnotherapist, so there's a lot of going back to scenarios, and I need to be able to hold really good,
Mm.
strong boundaries. And I was like, no way, can I do that? After the second surgery, I was back within a week. I was fine.
Mm.
So it was a totally different situation. So again, I didn't really have much symptom relief. I'm still getting the symptom relief.
My relief from part of it became was immediate. I could
Yeah.
immediately, pretty quickly within 2 to 3 months, walk, sit, and stand again. And
Wow.
I can now walk 10 miles. I've never had the cramping, stabbing, shooting pain. I've never had my legs neurologically quit again. So those little 1 centimeter cysts were the cause of much of that leg pain and heaviness, cramping, stabbing, shooting, and legs not neurologically working. Now, I found out in the middle of this recovery that I had lipedema, which also causes heaviness and some stuff there. But the surgery was absolutely for those questioning, does Tarlov cyst surgery work? For me, and I think we'll find for Keslie too, although
Yeah.
her story is a little different, it was a slam dunk. It absolutely does work and it absolutely restored the things it was meant to restore. So I hope it becomes more common. It was just taken off the rare disease list because I guess it's not rare and they're finding out that people are getting better. I pray to God that all of these surgeons are training new surgeons to repair Tarlov cysts because it's saved our lives. So let's talk about the metal thing. You had the metal put in 6, 7 months later, whatever it
Oh
was, you
no.
can tell us.
No, 3 months.
Oh, 3 months you had the
So
metal
it was
removed.
just January 19th, probably. It was the end of January. And all of the sudden, I had seasonal allergies and I was reacting to my gold ring. And I was like, what is happening? And then I was like, oh, Shari mentioned something about systemic nickel. Maybe that's what's happening. And I
Well,
messaged you.
yeah, and for people that don't realize, it's delayed. It's a delayed hypersensitivity reaction. It's type 4 cell mediated, so it's T cell mediated and antigen driven. So it takes time. It's not like a skin allergy where your skin and your tissues react right away to the contact. It takes a while for the antigens and T cells to mount up this army to mount this response. So for you, it was 2 months. I'll tell my story as soon as you're done with yours. For me, it was 4 months. So 2 months, you started having all these symptoms.
Yeah, started getting the systemic stuff. So the skin stuff, I was like, why is my ring bothering me? Like it didn't make sense. And I don't have seasonal allergies. So to be getting allergies was like, what is up? So I basically messaged you. You were like, yep, that sounds pretty systemic. So I just started treating myself like I had systemic. And I went on a low nickel diet. And instantly, the low nickel diet started to relieve some of those symptoms. And I wasn't having the skin reactions as bad. I'm still not wearing my ring. I haven't tried it since the surgery, I have to admit. It would just start irritating after a couple days because it was whatever was in it.
Did you ever
Um,
get tested?
no,
That could be important because there could be other metals you could be cross-reactive to.
I'm sure there is. So I just avoid all metal.
I guess that's one way to
Basically,
look at it.
I tell doctors I reacted to titanium, and that's all they need to know. I don't want to go any further. I said that to one doctor, and he was like, great, then we cannot do the replacement that we want to do. I was like, yep, I know.
And now, a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with MALISA testing. MALISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. MALISA, a valuable diagnostic tool in medicine. Okay, so you started reacting at 2 months. When did Dr. Schrot remove your hardware? And tell me about that
9 months.
procedure and tell me what happened.
So 9 months, I didn't listen to you and book the removal surgery immediately after, like I should have. So by the time I was reacting in January and going, I'm going to need these out for sure, he was 6 months out before I
Mm.
could get to him and get the surgery. That was just the earliest date I could do was in August.
Did he
So,
require a metal allergy test or he just
no,
believed you right off the bat?
yeah, he just believed me. I
Okay.
said, here's my symptoms. He said, yep, that's consistent with other patients I've had. And if your insurance will cover it, let's do it. And my insurance had no problem with it because it was listed as a nickel allergy. My doctor said I had just a nickel allergy. Dr. Schrot listed it as anaphylactic.
Interesting.
The Sutter, that's how much they respect it, which was amazing.
And
He
he
was,
was a really great doctor too, because
yeah.
I think I was his first Tarlov patient that had a metal allergy. And I
Wow.
hooked him up immediately on a phone conference with Dr. Scott Schroeder, who lectures doctors and surgeons worldwide on metal allergy. And he like embraced the whole thing. It's very interesting, the doctors that put up the walls right away and say, no, it's not possible, it can't happen, versus the doctors that say, let me find out more about this, and they dive
Yeah.
head in. And that was also weighed into my surgical pick, is a doctor who was like, no, I don't think so. Maybe if you feel this way, but I'll just indulge you, versus, let me learn more about this. And it's a different energy, right? It's not just for those tuning in who don't know. 20% of the population is allergic to nickel. Of that percentage, only 3 to 5% of that 20% are systemically allergic, which is like 1 to 3 patients out of 100. But if you're that patient, obviously it can really wreck your life. Did you have any other pain besides the allergies from when you became symptomatic?
So I was still, I would say, increasing in everything. I was getting more mobile. I could walk more. My symptoms were starting to go away. Some of them, like incredible stabbing, the sciatic pain, everything became more intermittent. I felt like I was getting better. Then
Yeah.
April came, which is when all the seasonal allergies kick in. So there was a heavier load. And
Yes.
all of the sudden, I was getting swelling around my sacrum and not like inflammation, like fluid. It was
Mm,
just like this fluid, like it almost looked like I had a little butt back there because the scar in the center. And it was like this. I was like, what is going on?
interesting.
And I started physical therapy because I started to decline again. All of a
Mm,
sudden, I couldn't sit as long. I was back in bed. I was spasming way worse. I was like, what's going on? Now, side note that makes my surgery a little different also is I am very thin. I did not have fat at the site to put inside my sacrum. They cut it out of my waist, essentially. So what
mm.
they do is they go in on my left side where I've traditionally had some issues, and that's where my curve goes one direction, is they cut into it, get fat, except that there's hardly any fat there either. So they
Mm-hmm.
essentially cut into my muscle, which is also an issue that I have. My muscles don't like to bounce back as quickly. So I've got this other now area that's spasming because those muscles attached to your sacrum. And what we don't talk about when people say, oh, when they open your sacrum, in order to get to your sacrum, they have to peel your tendons off of your sacrum. There's
Mm,
three tendons, I think, that connect to five different muscles, major
mm,
back muscles that hold your
hmm.
body upright. So back to the tendon situation, my collagen isn't right. My tendons don't recover the same. They're not built as strong. So you have the tendon situation when tendons are connected to the muscles. Now the muscles damaged also. It's this whole side of my body just starts spasming right away. So April, I go to start physical therapy, right? Okay, we're going to build my other muscles. My sacrum severely unstable, my SI joints unstable. Like I rock my pelvis and it's going click.
Thanks, EDS.
Yeah. And so all of these things. So my physical therapist is like, great, we're going to stabilize your hips. We're going to strengthen everything. And so she starts with isometrics. I'm okay. I'm improving on isometrics. The second she sits my body upright to do anything, I go into spasm.
Mm,
I can't even do a bridge with my legs on a ball because
mm,
what's supposed to not use my low back is completely engaging. She's like, how? This should be your stomach and your legs. That's another EDS thing. Different body parts engage in weird
mm.
ways because your stuff isn't normal. The tendons aren't holding everything together. So, where's your instability in your spine? So, other muscles have to kick in to
Right.
try to do the job. So, it's just all this nightmare.
Yeah.
So, what happened was I finally got kicked out of physical therapy because I was going to physical therapy every other week. I was going twice a week. I would be in so much pain after the second time. I couldn't walk. I'd be just back to being able to walk and move and do something, and it'd be time for physical therapy again. And now I'm crippled for 2 more weeks.
I'm
And
sorry.
she said, this is where I got diagnosed with the hypermobile Ehlers-Danlos. And in
Got
that, she said, I've got to stop with you. I'm going to hurt you. She
mm,
said, you need to be with somebody who understands this. I'm not specialized enough. It's this certain point in the process where it's, whoa, back up.
yeah.
So anyway, then I just waited and then I had the surgery in August.
To remove the hardware.
Yeah.
Okay, make a list of what improved when you had the hardware removed and how fast did you notice that improvement? And how was the
So
surgery? How was it to get it removed? Because there may be some people watching this that want to follow in your footsteps.
the biggest difference between the two surgeries was the emotional nervous system experience, right? I was shook after the first one, just unsteady in every way. That was not like that with this one. So it was a totally different, easier surgery. Opiates don't work on me at all.
Yeah, me neither. Strange.
Yeah, like there's genetic connections to this at all. So I come out of the surgery and I didn't have it last time either, but this time I had on the peripheral, they have to peel the skin and then they peel the tendons off. And when they're doing that, they're pushing everything back to a certain peripheral edge. Somewhere in there, I had an angry nerve.
Mm,
And it was some of the most severe pain I've ever felt in my life. And I had 3 kids naturally.
okay.
It was like I had 100-pound weight pulling on one part of my back, a muscle. It was excruciating. I still have this weird little spot that does strange things, and some
Okay.
other one. If I run my finger down my scar, I
Mhm.
feel it like 2 inches away down the peripheral of the area. So there's some weird nerve stuff going on. But again,
Okay.
it's healing. Nerves heal.
Right.
They take a long time. Here's a strange one that might feel a little woo, but energetically grounding, like literally tapping into the earth and feeling the earth's energy. I could not ground while that metal was in my body. Couldn't do it.
Okay.
Couldn't figure out why. Trusted it was the metal. I know metal's a conductor. So when you're dealing with energy, metal does stuff. The
Okay.
moment those were out, I was like, "Shoop, oh, I'm back. Oh,
Okay.
okay. So I could get back into my body in a different way. There wasn't a ton of other big shifts right away because what this also did was flared up mast cell. And I didn't have mast cell activation syndrome before, and I'm pretty sure I have it now. All of a sudden, weird things. I shouldn't react the way that they react into foods and things like that. So they're starting to get better. I'm not having to take antihistamines all day, every day anymore.
But
I
you were
have
taking them for what purpose?
So how I get my symptoms that I get from the is sinus, it's mucus. My mucus
Okay.
membranes act up. I feel like I'm sick, so I get sinusy, I get postnasal drip, and my gut gets super flared.
Any bowel
Super,
issues?
super. Tons of bowel issues,
Okay.
constipation, and nausea, just irritated stomach, weak stomach, just no appetite.
And did
for
all of that resolve when the
appreciation.
metal was removed?
Not all of it, but it's getting better.
Okay. But
It's
you
getting
saw
better.
improvement from that point, so you knew you were on the right.
Everything's been getting better. And that's part of why we took so long to have this call is because I was trying to see all of the things. And so the sexual stuff, that was huge. I had the best orgasm I'd had in a year and a half. I was like,
Okay.
what? It's back. Okay.
Yeah.
It still can be intermittent. A couple times I'm like, oh, it's gone again. Okay.
Mm.
But I just trust that it's healing. No
Healing is
nerve.
not linear, right? And for those who didn't know my episode, so for me,
Yeah.
I knew that I would probably have symptoms from the trace nickel because I know that trace nickel does that. So I expected it, but was obviously hoping I wouldn't. I've had a lot of metal removed from my body and it was at a pretty good baseline before the surgery. So I had my surgery in, I think December, maybe early January, but 3 or 4 months after I had the surgery, I had a repeat orthopedic analysis blood test and it came back with my nickel before it was like a 6 point something. Now it came back at a 12. And I'm like, why is it doubled? I've had all this metal removed. I'm on a low nickel diet. I didn't know. I didn't even think about the Tarlov surgery because I just wasn't having symptoms at that point. Like a month and a half, 2 months later, I started having all kinds of systemic pain again and allergy symptoms like you. I had sinus stuff. I had massive brain fog and massive fatigue. And what I only hypothesize now and looking back is that my body and my immune system were reacting before the symptoms showed up on the exterior. And I was just like, I finally was like, oh yeah, it's got to be the metal plates and screws. And then fortunately, I had scheduled my surgery at the time I had my Tarlov surgery done for removal. So I was only about 6, 7 months out. And literally the second it was removed, like all of it was gone. The brain fog, I could do math in my head again. The systemic
Wow.
pain was gone. Before my surgery, I had weaned down to half an Allegra once a day. But when I became symptomatic again, I had to go back to 3 Allegra a day. It's the only way I could function because
Wow.
that's how
Yeah.
much those 2 little microplates, 8 little screws, that's how many symptoms and literally gone immediately. And I think Dr. Schrot is still, even though he did embrace it, is still like just blown away by that. And you're the second or third person I know who's had the metal allergy and the Tarlov surgery with him that's had the plates in. I think you're the first I've known besides me that's had them out. So I
Wow.
think we're paving the way for these other
I didn't,
people. When you told other people, like in the Facebook group,
yeah.
that you had your surgery removed, you were reacting to the metal, you were improving, how did they react? Were you
I
believed,
haven't
missed?
told too many people. I will now that we've done this and
Yeah.
I've finally talked about it
Yeah.
because I was waiting for more things to clear up. I was like, I need really hard, good evidence. And because I'm still healing, we just have different experiences. Bodies are so individual.
I feel like you have good evidence. It
Yeah,
sounds like the nose thing is like way
it's
better.
getting
It sounds
better.
like the
Yeah.
sexual symptoms have improved. And
Yes.
just because they don't all go away overnight, I think you've seen
Right.
enough concrete, correct me if I'm wrong,
No,
please,
no,
but I
yeah.
think you've seen concrete improvements before
At this
and
point,
and
yeah,
after.
yeah. By now, I'm feeling confident and okay, I see the things. I'm not back upright. Do you know what I mean? This is one of the longest I've been up. I just actually got an electric wheelchair. I'm super excited. It reclines, and I'm like, yay, I get my life back.
Ah,
Um,
interesting.
and so it's time, and it's like I'm up too long, and I can feel those tendons starting to peel and put pressure. I think
Mm-hmm.
it's just time, and everything's going to keep healing. I'm doing a heavy metal cleanse right now. So I'm starting to detox some of what was in
Mm-hmm.
there. I think it was just really stored up. I'm also dealing with perimenopause and long COVID. And so trying to
Right.
figure out exactly what symptoms and when. And when you've got a list of 50 symptoms, do you even notice when some of them lighten up? Yeah. So I haven't had too much talking to other people. But I really want to because I see so many women with similar issues. And when they're like, it's just worse and I have this pain and this never went away, I'm like, go get that
And like you, I think we both feel very tied to the Tarlov community, and we know that there's going to be a small percentage, and it is small, of people that
yeah,
are metal sensitive, and we don't want them to have to go through a very invasive, very difficult. Not everybody has an easy recovery. I had an easy recovery. You didn't.
yeah,
And that's probably a pretty good representative of the whole. Some people recover easy, some don't. But the last thing we would want is any of our Tarlov sisters and misters to go through this surgery and 6 months later have debilitating pain and symptoms and think that the surgery didn't work. It very well probably did work, but they may be having symptoms that a particular surgeon that's not Dr. Schrot, not well versed in metal hypersensitivity, is going to be able to realize because it's just not part of the medical narrative. And I think I've mentioned this before on my podcast, but I said to my vein surgeon, why do not doctors with medical degrees that understand that technology and things evolve? We know things today that we didn't know 10 years ago. Why can't they consider this as a possibility? And he said, it's one word, it's dogma. They're taught this. He said, my professors in school brought me this big stack of literature and said, by the time you're out of medical school, 3/4 of this will be proven untrue. And so always keep an open mind and always continue to learn. And he said a lot of these surgeons, they really have a lot of pride in what they do. And if they had to believe that something that they have done was causing harm to patients and sometimes severe harm and severe disability, a lot of the surgeons fragile ego, and I'm not going to criticize that because we all have egos, right?
Yeah, yeah.
But they can't live with doing that much damage to that many people. And that would be very
Right.
hard for a surgeon with an A-type personality to live with. It's really hard. Some surgeons are great to admit
Totally.
when they're wrong, but a lot of them, they just can't or they don't want to. And maybe it's just the burden of that. But
Yeah.
I know for us, it was life defining. Don't you feel like it was defining for you to
Totally. Another thing that I just remembered, I was like, oh my God, how do I even forget this? I could feel them in my sacrum before the surgery.
really?
I could
Okay.
feel them. I know. When you told me, I'm pretty sure you had 3 plates and 6 screws because my brain was going, God, but it feels like there's four. Like it feels like I could just touch my sacrum and I would be like, oh, there's one and there's one. Not feeling it, feeling pain. Because I would touch and it was like hot spots that were just these 4 points that were excruciating to touch. And they're gone. That was immediately
Interesting.
gone.
Wow.
I
Okay.
felt and I was like, it's gone.
That's
Oh,
really significant.
there was another one. Bending forward, there was
Uh-huh.
a pull on my sacrum that was weird. This like tension. It's still there a little because they pulled the tendons off. Nothing like it was.
Right.
Nothing like it was. So I know that everything's working better than it
Mm-hmm.
was.
Right.
Everything was just unhappy in there. And it's interesting because it didn't affect inflammation the way that you would normally think. Anti-inflammatories don't help me.
Interesting.
Low inflammation diets don't help me because it's not
Well, except
inflammation.
the low nickel diet.
It didn't help my pain levels so much, but it helped all my mucus stuff.
Interesting. And see, for
Definitely.
me, it's different. It's so interesting the way it manifests. For me, it's pain, but it's not for
Right.
everybody. There was a list of 50 symptoms. It can be cardiac stuff. It can be POTS-like symptoms. It can be just brain fog. It can be insomnia. Now, I don't know about you. I get hot flashes and cold flashes. I have a really hard time regulating my body temperature.
I started getting hot flashes in 2023, perimenopause stuff, and I started taking this product called Provitalize. Get
Heard
it
of
on
it.
Amazon. It's basically probiotics. I think there's turmeric, black pepper, maybe like moringa root or something like that, moringa leaf or something. And it stopped my hot flashes literally in 3 days. Gone.
Mm.
So I don't know. But I think what's happening is having the metal out. Now my body's not like liberating the nickel
Well,
and it feels
yeah,
like it's,
the invaders moved on.
and so now the nickel's, what do we do? Ah, okay. And so
Yeah.
everything's coming back into focus. But I now have this mast cell stuff that I never had before. I was on an arugula kick and I was eating arugula for a couple days and all of a sudden I'm having like what feels a hot flash, but it's like this tingly, like a
Tequila is
niacin
not low
flush.
nickel, my dear.
Oh, I did not check that this time. I guess I've been starting to eat more things. Oh, shoot. Okay.
There you
So
go.
it may have made me systemically sensitive in a way that I was never systemically
I
sensitive
think a
before.
lot of people don't think about stuff. And it's just, I oftentimes think I'm doing well. And then all of a sudden I'll get this nasty chicken pox looking rash under my armpits. And I'm like, and I now know it's because I ate nickel. And I'm like, I have to go back and
Hey.
think, what did I eat a day ago that had nickel in it that I didn't know? And this time it was candy corn. And I'm like, dang it, son of a gun. It's made on material with nuts and there was some soy in it. And I'm like, cheap Walmart candy corn. And so now I'm sweating out nickel in my pits. That's where it shows
Hey.
up. And oh, the craziest thing for me. So I have a fusion at L5S1. So I still have a cage there, even though my hardware was removed and now all the sacral hardware is gone. But I also have a fusion in both SI joints. So I have 6 pieces of hardware. I used to get this really nasty cold sore looking a bunch of sores at the top of my butt crack in the middle of it.
Oh,
And
yeah.
I thought, oh my gosh, but I could never figure out why it would just come and randomly go until I figured out, oh my gosh, a day after I eat like raspberries or cashews or something really high in nickel, that's when it busts out. And it busts out there because that's where the metal is. It's really close to that,
Yeah,
right?
that makes
And
sense.
now it is absolutely, I could program it. If I want to break out there tomorrow, all I got to do is eat a bowl of raspberries and I will have nasty stuff in my butt crack tomorrow. I mean,
So I'm gonna admit that once that nickel came out, I think I stopped eating low nickel diet. Like I just was like, I don't
oh
need to
yeah.
worry about it anymore. Because you just said raspberries, and I've recently realized I can't eat fruit. Like a lot of fruit totally messes up my gut.
Yeah, let me tell you what you can eat. Probably no problem. Apples, no problem.
Okay,
Probably pomegranates, no problem.
that would make sense.
A very not like a barely ripe banana that hasn't gotten
That,
any brown spots on it.
yeah,
Those are
yeah, yeah.
probably
I
fine.
hate them once they're past that, anyways.
Yep, those are probably fine. Blueberries are the least harmful berry as far
Okay,
as berries go.
okay.
And I just had in my blueberry smoothie. But yeah, it's just blackberries absolutely wreck me.
Oh, I
Spinach.
got.
Once you have the systemic allergy, the diet is really proven to be key for a lot of people. And it's not just the diet, it's the cooking in the stainless steel, the drinking from the stainless steel water bottle. It has massive
I
effects.
I used to have all metal everything, metal straws,
Yep.
metal containers. I was like, metal's the best. And now I'm like, oh, I was poisoning myself.
And
Thank,
even it's not poison because it's just an allergy, right? So
right.
you may have some elevated ions in your bloodstream, but usually it's just an allergic thing. And it's crazy how you can touch silverware and people think I don't have any skin reactions. And I had somebody recently write into the podcast, just because you don't have any skin reactions where you touched, what happens on your feet the next day after you've touched silverware? And I'm getting so many light bulb moments. So
Wow.
that touching of the metal doorknob or the metal whatever, even if we think it's not happening, it really has systemic effects because people forget it can show up anywhere on the body. They're
Thing we
looking
didn't
for it on the
realize,
hand.
my boyfriend's a guitar player.
Uh-huh.
They're nickel strings.
Yes, they
He was
are.
like, babe, I cannot touch you. I have to go wash my hands after I play my strings.
He's not
Like after
wrong.
I play, he has to make sure he doesn't come and give me a hug or something and touch
I,
me because
yeah,
it's just
because
gonna
it will
overload.
affect you. Isn't that
So it's
crazy?
basically for life now, huh?
I really think the testing would probably blow you away.
Okay.
But yeah, it doesn't go away. It's managing
And see,
symptoms
my
at that
brain was
point.
like, once I get the nickel out, I'll be fine again.
And I
And that's,
wonder if you're truly having mast cell or if you're just eating high nickel and touching a lot of nickel in your environment.
yeah, I gotta look at my silverware and stuff.
So
I
1810 is that 10 is nickel. You got to move to 18-0 or ceramic lined.
I had my first reaction to razor blades that I would not
Mhm.
even have noticed, but I'm in one of
Yep.
the nickel groups and heard people talking about razors, and I shave my legs and I'm like, I am breaking out. These are tearing up my legs. I return them to Costco. And all of a sudden, as I was returning them, he's like, is there anything wrong with them? I was like, yeah, they tore my legs up. Like, I don't know if it was just a bad batch or what. And all of a sudden a light bulb went off and I was like, I looked at my boyfriend, I was like, I wonder if it's nickel. And the guy goes, honestly, I've never had a return of these. I was like, oh,
Yeah, and
okay.
like now I can use titanium razor blades no problem. And there are trace nickel, I'm sure, in the titanium razor blades, but
Right, right.
that's not a problem for me.
Yeah. So I think the other brand, I've had one brand I've never had a problem with, never gotten razor burn, never had an issue. And I'm like, I bet you that's it. I bet I've been blaming these poor razor blade companies. Like I
Oh,
have blades where I just assume 10% of the razor blades are going to go in the garbage.
yeah. I'm almost betting that if you're not
It's
careful about your diet and your environment, your mast cells are reacting, but they're probably reacting to nickel, would be my bet. That's my bet.
okay. I'm going to take on that challenge and really
Yeah.
change my
And it's
diet
funny that
back
now I've
and
gotten most of
see.
the nickel out of my diet. When I sit down and have a Caesar salad, I just plan for the next day. I'll take an extra allergy med before bed and
Yeah.
put some triamcinolone in the armpits. I want to ask you, what do you think that patients and doctors need to know? If you could talk directly to spine and neurosurgeons, what would you like them to understand about metal allergies and Tarlov cysts?
They're real. Please pay attention and do more research. Talk to people and listen to what they're saying and listen to the
Mhm.
similarities that we have. We're not asking you to take blame. We're just asking you to acknowledge our experience. We're not saying you're bad. We're just saying sometimes there's an incompatibility, and that incompatibility is with my body. And please trust me, I would like to get the best care. And I know that they want to
Yes.
provide the best care.
Yes.
So I think in order for the patients to get the best care that they can and for the doctors to provide the best care, communication is vital. And so learn. And if you don't know, instead of shutting it down, just be curious. Just be
Yeah.
curious.
And I always say just because a reaction doesn't show up on your lab work doesn't mean it's not happening in your body. The body has a lot of ways to say no, and not all of them are tidy or easily measured.
Yes. And try things. Test it out. Use your symptoms as your guide. Listen to what's happening and trust those things. I'm actually working on an app to do that for us
Nice.
that can quantify our experience, that really gives us a visual of our symptomatic experience because it's not taken into consideration. Our symptoms there, you go into the doctor and you're like, hi, I have 50 symptoms. And they're like, whoa, great, let's focus on one thing. And you're like, but I'm a whole system here.
Yeah.
We need to look at everything. And
And
in
we
the United States, conventional medicine doesn't typically look at your diet.
Sure. And we
So
both experience the gaslighting side of medicine. So like when you meet a surgeon that actually listens, it's disorienting in a way.
you
Right.
go
Yeah.
in ready to fight, like armed, and you're like, I'm ready. And they're like, awesome, thanks for bringing everything. And you're like, wait, what? Wait,
Yeah.
you're gonna
That's
listen to
classic
me?
Dr. Schrot. We should have had him on the podcast,
That
but
would be so awesome.
poor guy's
Yeah.
not here
I
to
mean,
defend
it's
himself.
just he respects your experience. The doctors that say, look, I'm a specialist in this thing, but I'm not a specialist to your body.
I'm sure you felt believed and heard by Dr. Schro. What did that do for you emotionally after everything you've been through? And how important was his openness to the idea that metal hypersensitivity could be a part of what you were experiencing? And then,
It was so important. It just empowers you. When your experience is validated, you feel empowered. You feel like things are going to be okay. You're heard, you're seen. That's all we want in this world is
right,
to be accepted and seen and heard. And when we're having an experience and the doctor looks at you and says, that's for your gynecologist, it's in your pelvis.
right,
It's my spinal cord. No. And
right,
clearly it's, oh, you can't fix it. So you're going to tell me it's not happening. Okay.
right,
So having him acknowledge the cysts, specialize in the cysts, and no questions about getting the metal out, and so supportive and curious and how are you doing and what symptoms have changed, and they care, they follow you and they really
right.
care. And that's a doctor that really wants the best outcome for their patient, not the best outcome for
Their practice. This is what I hope becomes more common in medicine, curiosity, humility, and partnership with the patient, because
yeah.
that's where it's at. Let's bring this home with some advice and encouragement to the people who are
Yeah.
listening and seeing
Yeah.
themselves in our story. Let's imagine somebody's listening right now who has like weird pelvic sacral pain, the MRI report mentioning Tarlov cysts were incidental. They have a history of nickel allergy or weird reactions to metals, and then doctors telling them we don't know what it is or it's not that. What would your advice be?
Find the right doctor. Keep looking, don't stop. Validate yourself, fight for yourself, educate yourself, and keep finding, keep looking, find the right provider. There's a lot of online providers now using the group resources, Facebook groups, and things like that, where it's people talking. You're going to
Hmm.
get a different level of resources when it's, I did this, I had this experience, and then a bunch of people are agreeing with it. And stay strong and don't compare your experience to anybody else's story. That
Right.
is huge. You can use them. I used your story and your super easy second surgery and your fast recovery as a goal.
And then you were miserable for six
But I
months.
also trust that the universe is providing me exactly the
Right.
experience I need to have.
Are there any specific resources, websites, support groups, books, tests that
Um,
you found helpful?
Definitely the Tarlov Cyst groups, there's two main Tarlov Cyst groups. I cannot remember which is which. I always get backwards. I'm
I'll
going
give
in.
a shout out. One is Tarlov Cyst for Sisters and Misters, spelled
Yes,
Cysters.
I love that one.
There's Tarlov Cyst Society of America, Tarlov Cyst Support for Sisters and Misters. There's Tarlov Cyst Society of Canada for all you Canadians. I'm sure there are other groups.
Dr. Schroed's website has a lot of information as well and some patient stories and things like that.
What do you wish you'd known earlier that might have saved you time, pain, or emotional trauma?
What would have saved me time and pain is knowing all the ways that the nickel allergy could affect me. If my ring hadn't have started acting up, I would have assumed I had seasonal allergies, I would not have connected the two. I would never have connected that the gut situation that I have could be connected. Wouldn't have crossed my
Mm.
mind because nickel and allergy is skin to me
Yes. And
in my
it's just so many.
experience. So it wouldn't have been even on my radar. And if I
Yeah.
hadn't had you to say, hey, this is really strange, I would have been like, okay, why is my ring reacting? I would have taken my ring off. I would have maybe done allergies, but I would have been addressing a whole different situation and I would have been flaring up and I would have been worse. I can't even imagine if I was on a high nickel diet. And now I wonder if I'm poisoning myself again.
No, it's not poisoning. It's just allergy. I really feel like this needs to be as big or bigger than a gluten allergy because when the light bulbs go off, people are going to be like, oh my gosh. And we're going to see so much healing.
There's high nickel in gluten because I'm also gluten intolerant.
It's not usually the gluten, it's the wheat.
Wow.
You may
Right.
not be gluten intolerant because, like, I can eat white sourdough bread, no problem.
Other things, I get mostly constipated from it. So
Gluten-free grains are super high in nickel. So tell me real quick on a personal note, how has going through Tarlov cyst disease, metal allergy, and multiple surgeries changed you as a person?
I think I'm more resilient. I've had to stay positive in a different way. I've had to use every tool I have in my emotional toolbook, my mental toolbook, my acceptance for life toolbook. I have a lot of accommodations in my world now.
Yeah.
I think it's also been a really powerful self-acceptance journey and not blaming myself, not blaming my parents for my genetic situation and just this is who I am.
Yeah.
And years of being put down by my ex for it and treated as broken and something's wrong with me. And this energy where something was wrong, living a lot of my life like something was wrong with me. And now going, it's okay who I am. I'm different. And there's a reason that I'm different. And I've got to figure out the reason. And the app may be a big part of that. I think it's actually increased my self-esteem some to be in this situation and just have to keep my chin up because
Yeah.
when your body's falling apart, if you can keep your mind and your
Yes.
emotions together and stay positive, I still feel fortunate. I
Right.
really do in
Well,
every experience.
and you're going
So
to help a ton of people just by coming on. So I thank you for that. To everybody who's been listening, so if you have been dismissed, misdiagnosed, or told that what you're going through doesn't make sense, I want you to hear this clearly. You are not crazy. Your pain is real. And sometimes the missing piece is something the system isn't trained to look for, like Tarlov cyst disease or a metal implant. The system is quietly attacking every single day in these instances. But there are doctors out there who will listen. There are surgeons who are willing to look and think outside the box. And there are other patients like myself, like my guest, who get it. So if this episode resonated with you, please share it with somebody who needs validation or with a provider who might be interested in learning more, because that's really how we change the narrative. And we do this one story at a time. So thank you, Keslie, for your courage, your vulnerability, and for being willing to revisit some really hard parts of your story so that other people don't feel alone in theirs. And thanks for being here with us to help tell the medical community that we're not going to take it anymore.
Yes. And thank you, Shari, for doing this, for rocking this, and for being a guide for us. Because having you, I couldn't have done this without you. So I'm really
Oh,
grateful that you speak out about it and that you're doing this. We just need to hear it and to hear I'm not alone and you're not crazy.
you're not
So
alone, girl. We got you.
we're here.
Okay, keep on rocking.
You too. Thanks.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavenlymetal.com where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.